I'm Doc Shea, your smile doctor, and in this video, I'm gonna tell you everything about wisdom teeth. All your what, when, how, and why will be answered here, so just stay for a while because later I will show you how this procedure is done. If you need to get a consultation for your dental concerns, please visit these pages that I will link in the description box. Because my patient is young and cooperative, I was able to finish the surgery in just 15 minutes. The length of the surgery will depend on the difficulty of the case, so the position of the tooth and the age of the patient play a factor. So my patient is in her early 20s. She complained about pain on her left jaw, mild swelling in her cheeks, pain upon biting, and sometimes difficulty opening her mouth. Before we skip to the surgery part, let me answer this set of questions for you. What are wisdom teeth? Formerly called as third molars by dentists, are the last set of molars that most people get in their late teens and early 20s. Why are they called wisdom teeth? Because when these teeth come in, it means you are an adult and presumed to be wiser by now. How many do we have? Usually we have 4 wisdom teeth, 2 on the upper and 2 on the lower, but you can also have 1, 2, 3, 4 or more wisdom teeth, and sometimes none at all. Don't worry if you don't, you are actually lucky because you are spared from the discomfort and tooth removal expenses. If there aren't any room for the third molar to erupt or break through the gums, it is considered to be impacted. It can be fully impacted, which can never break through the gums, or totally not visible in the mouth, or partially impacted, wherein part of the tooth is visible or erupted. What are the symptoms you'll experience when your body is telling you that it's time to let it go? First symptom that you'll usually feel is pain. Pain when you chew, pain when you aren't doing anything, pain in the jaw and difficulty opening the mouth, or redness or swelling of the gums, swelling around the jaw, bad breath, and unpleasant taste in your mouth. Now, what will happen when you don't have it removed when these symptoms appear? You'll experience so much discomfort. It can cause damage in nearby teeth, especially if it pushes against a second molar. This is very common to partially erupted third molars where part of its crown is showing. There will be an opening in between which will be harder to clean and very prone to decay. That opening will collect the food that you eat and will be stuck inside. Then gums become swollen and painful, and this condition is called pericoronitis. Due to an unknown reason, a cyst, which is a fluid-filled sac surrounding the third molars, can form and grow bigger and eat your bones away, as well as displace your teeth. To get a clear view of the teeth, we request for a panoramic x-ray. Impacted wisdom teeth can be classified according to its position in relation to the adjacent teeth. So the mesioangular impaction is when the crown is angled towards the front of the mouth. Vertical impaction, if the tooth doesn't break through the gum line, straight but trapped within the jawbone. Distoangular, it is angled towards the back of the mouth, and horizontal is when the tooth is angled sideways or angled at 90 degrees as if it is lying down within the jawbone. Now that you understand a lot about wisdom teeth, let's see how the surgery is done. This procedure is called odontectomy, which is the surgical removal of impacted teeth. First, I numb the tooth and surrounding area so she can't feel any pain and discomfort. This is a very important step because it is really hard to remove or even do any dental procedures if the patient constantly complains of pain. A painful dental procedure results in trauma, which makes a patient less likely to go back. Next, I made a small cut in the gum tissue to expose the tooth and bone. When I can visually see the crown of the third molar, I sectioned it into 2 parts to make it easier to remove through the opening. If I didn't section it, it won't be possible for me to remove the third molar because there was no space unless I remove her second molar, which I never do if it is healthy and functional. Or I do a lot of bone reduction, which will be traumatizing and the healing time is slower. Then a bit of pressure can be felt but not painful because there's a need for me to rock the tooth back and forth. When it's loose, I pulled it out, sutured it, placed a gauze over and had her bite on it, which will allow blood to clot.
Yung surgery mismo, may masakit doon?
Hindi naman po.
Komportable ka naman?
Apo.
And that's it. That's how the surgery is done. So you don't have to fear. You just have to bear the constant pulling of your cheeks. Nothing to worry about. We will be as gentle as possible. Recovery time. So initial recovery and healing occurs about 3 to 5 days. Things to remember: swelling is normal and will peak at second or third day after surgery. Soreness and stiffness will last for 5 to 7 days but will be tolerable.
Be on a soft diet for a few days. Avoid hot and spicy foods because it can cause irritation. Avoid alcohol intake. Avoid excessive exercise. Don't forget to brush your teeth gently and avoid the area where we did the surgery. Most importantly, avoid smoking because these contribute to the delay of healing process. Avoid excessive spitting and gargling and drinking from a straw which might dislodge stitches or blood clot.
This blood clot is very important because it protects the bone during healing. If it gets loose, you will have a very painful experience called dry socket. So whatever you do, do not disturb it. We prescribe antibiotics to prevent infection and analgesics to relieve pain. So remember, follow specific instructions so there won't be any delay with your healing time. So final question, when is the best time to get your wisdom tooth removed? So the best time is before 25 or when 2/3 of the root is developed. Because at this point, enough root structure exists, yet it is not completely formed, so it is still short and blunted. For this reason, there is less resistance to removal and won't be prone to fracture. In short, it's easier to remove. However, old patients have longer roots and more likely to be close to important structures like the nerve. The bones of older adults are denser and harder, so we use a greater degree of force or more bone reduction. What I'm telling you here is the older you get, the more difficult it is to remove your third molars. But regardless of your age, if you feel the need to remove your third molars that causes discomfort, then don't be afraid to go to the dental clinic. I myself experienced repetitive pain when my third molars were coming out, so I had it removed. Don't bear the pain and get proper treatment. If you find value in this video, I would appreciate it if you like, subscribe, and share. Click the notification bell all to stay updated on my latest videos. Also, comment below to say hello. I want to hear your thoughts about this video, and if you have any questions, you can ask me on my Facebook or Instagram. And also follow me on TikTok for short video dental tips and some other craziness. Thank you so much for watching. Remember to eat healthy and smile nicely. See you on my next video. Bye!